Hey, welcome to the Cam Otis Show. This episode joined by Laura Purdy, Army vet. Yes, vet. I had to check my memory banks because I was doing some reading on you, and it was like, wait, what's the math today? Right? Because you're a new. I'll still call it new vet. Has it been a year since you got out of the Army yet?
Not quite. So still within the first year.
Yeah. So
Fresh out.
Fresh out. Yeah. You're still figuring it out. Well, good to have you, Laura. Really appreciate you taking the time. One of the things I always like to know is what drove you into the medical industry? Because it takes a lot of extra schooling, and unless you like schooling, just saying, nothing wrong with that.
Yeah. So I will confess that I do like schooling.
Okay.
I do like schooling, but honestly, I'll tell you what happened is what drove me to the medical field was a failed music career. And I wouldn't even say that it was failed. It was a very successful music career, actually. But the people weren't very nice. And this is going to sound really ironic coming from someone who was in the Army for 15 years, then went to healthcare, but I was too nice to be a professional musician. And so I know.
I have never heard that. So I just got to say that too nice to be a professional musician. Wow.
I couldn't do it. I wasn't willing to achieve my own success by undermining the success of others. And I was the recipient of that behavior. And I said, I'm done. And my dad said, go do healthcare. And I said, great, sounds fine. Guess I will. And
that's some great dad advice. Why did dad say, okay, sweetheart, give up the singing stuff and go be a doctor? What?
So, well, the whole story is his sister is a nurse practitioner here in Nashville. She still is. And he said, my sister's a nurse practitioner. She seems to like her job. And then he said, okay, because, this is like a father-son thing, right? So we'll say this is the dad. I'll give you the real unedited dad version. He said, go be a proctologist. They focus on one area and make a lot of money. It's his words. I did not.
I love your dad. He and I are definitely on the same dad lately.
Yeah. And I said, okay, did not. Went into family medicine, but that was the actual advice.
That's perfect.
What?
Go ahead, Cam.
I was just going to say, what drove you to family medicine? Because I always find it interesting when I talk with people in the medical field to see how they wound up in the different directions they wound up.
I'm going to answer this question, but I'm hearing a theme emerge in the answer to my questions, right? I chose family medicine because they were the least unkind specialty. You rotate everywhere, and I hated, honestly, and some of it, at the time, maybe I needed to toughen up a little bit, but maybe not, right? Maybe this is inherently who I am, but it just made my skin crawl sitting in meetings where doctors would be just taking sharpshoots at each other, or just, publicly embarrassing their residents or their students who they're responsible for teaching. But surgery and even internal medicine and OBGYN, they're just so mean. They were just so unkind to each other. And I hated sitting through those meetings. I hated being treated that way. I could never imagine myself being a staff and treating my students or my peers. It's just not in me. But when I did family medicine, they were so nice and they were so pleasant, and I enjoyed it, and I didn't fear being around them. And I said, these are the types of people that I want to work with. And that's why I chose family medicine.
Without throwing anyone specifically or any organization under the bus, unless you want to, of course, Laura, your show too. Why do you think that is, that you see that difference in, some aspects that, some groups of doctors might not have that attitude? Because you think, because it's like you're taking care of people, you want to be the nicest. But then I've also got plenty of stories. The Dr. Death one comes to mind, if anyone knows that, of, the different doctors that, they warp it in a completely different way and wound up on the other end of the be nice spectrum because they are saving people, but then they're terrible people. Just take a stab at what might be causing that. Is it a cultural thing? Is it something that can be changed?
Good question. And I've never been asked to speculate on that before, but if I had to guess, I think it has a lot to do with systemic ego problems, just pride, arrogance. I'll never forget on my first day of residency, and anybody who's listening to this is just going to chuckle because I know they're going to remember it too. But Colonel Higdon, one of my favorite professors of all time, and was very short-lived because he took a job elsewhere. But he brought us in on our first day of residency or internship, family medicine. He said, I want you to remember that nobody cares that you're a doctor except your mom. But the intent of that was, don't walk around this hospital like you own the place. Don't have ego. Don't be arrogant. You're not better than someone else just because, oh, you're a doctor now, or, oh, you can prescribe medicine now. And I just think there is a lot of systemic arrogance and entitlement. And I still see it. I work in the hospital less and I'm not in the military at all, but I still see this arrogance and entitlement and this belief, this elevation. Some people call it a hero complex or a God complex, and it's just unnecessary. And I think it gets in the good way and in the way of good collegial relationships and good patient care. I mean, it's just like in the Army, right? Like your mission can actually be impaired by people's egos getting in the way. Mm-hmm. Can it be fixed? That's a good question. I don't know. I mean, you've probably been involved in institutions that will have like anti-toxic culture programs, but you can't use institutional. See, look, he's laughing. Right. I know he's laughing because he knows what I'm about to say, but can institutional programs fix personal problems? I don't know, or character flaws or narcissistic personality disorder. I just don't think so, but I don't know.
What that reminds me so much of it. So I'm glad you took the time to speculate on it, because what that reminds me a lot of is studies around a lot of people who do really well in business and how they make basically terrible choices because they wind up being the least risk averse people. And so they just bet on themselves constantly. And so you wind up with a guy at the top who just got lucky 5 times in a row and actually has like no sense of what he's doing, but he's just taking the risk all the time. And because of the way the system's set up, it kind of favors the risk. I could see in that system how it favors a little bit of ego, because you got to be the best there to go do that type of a thing. To put your hand up to be the first one in line, you got to have a little bit of an ego for it. So I could see how you kind of self-select on accident the ego, and it kind of just builds and builds and builds.
Sure. And it's not to say that these folks aren't very proficient at their skills, because we're talking about like the best surgeons and the best doctors and highly smart, proficient individuals at what they do. Horrible people skills, not good teachers, and the folks that thrive in that environment went on to be equally as successful. And people like me said, no, thanks, and made other choices.
I'll just say, Dr. Paul out there, I'm okay with you being an asshole when you need to be, as long as you did the knife. The knife was straight and sharp. It worked. So I'll just say that I'm okay with that. The other
ain't it funny? Ain't it funny how there's that level of like skill that we start to accept people being assholes at their job? It's like, all right, well, he's the best mechanic in town. You got it, so what?
Well, and that actually is my segue to jumping in on this one, Laura. Is you're focused on being a doctor, but yet you're in the Army, and the Army doesn't let you just do one thing, right?
Nope.
Because you got to, well, I guess you put it here. I mean, back in my day, you wore it up here. The rank on the collar says you got responsibility. So how did you balance that? What do you think about that? Because, you go into the Army to take care of families. And the Army's like, yeah, that's okay, but you got to do this too.
Let's play a game called Guess What the First Thing I Had to Do right out of residency was. My first job outside of residency was operational, which is so for physicians. It used to be they had very clearly defined tracks. Like you could do the administrative track and end up, at the Pentagon or something someday. You could do educational track, which culminated at residency program director, or you had operational, which ended up at division surgeon or something like that. Now it's more blended and they want you to be well-rounded and do all of it. But so that's what operational job, right? So it's a battalion surgeon, which just means another captain in the pool. So the first thing that I got assigned to do when I showed up at my first operational unit was, you want to guess?
No idea. No idea.
It was 100% sensitive item inventory.
Yeah.
And we were a highly deployable unit. So we had a massive S6.
That's a lot of cables to count. So I just tell you.
It was a lot. I'd never seen a layout in my life. I had no idea what I was doing. But this is what I will say. The only way, in all seriousness, back up. And then that was followed by a 30-mile drive and a night check ride. And then I had to plan a day land nav exercise. I was a brand new doctor right out of residency, and those are all the things I did in my first 90 days.
Oh my gosh.
It was great. I'll tell you how I made it through all of that, though, was honestly NCOs. If it was not for because my bosses didn't care. Like my major, my colonel, they're like, don't talk to me about not knowing how to do that. Go do your job, Captain. They want to hear from me, which is fine. Right. But it was the NCOs. I had some phenomenal E6s and E7s and some medics that were like, yeah, we know you don't know how to do this. And they brought me in under their wing. And, technically I was their boss. I was the head of the med shed, but they were working with me and they wanted to support me and they wanted me to do well. And they brought me in and said, hey, we're not going to let you fail at this, but we also acknowledge that you have no idea what you're doing. And together we made it through. And I think anything that has to do with being a soldier or, all the other Army going to the range or even PT, because I'm just not an athlete. I was a music nerd. Guess how many sports I ever played in my life? Exactly 0. Yep. And, how much had I ever run in my life before joining the Army? Not at all. Right. And so even PT, every single non-medical thing that I ever had to do was only successful because of NCOs holding me up and upholding the NCO creed to be supportive. And they own that. And I would not have made it as successfully as I could have in the officer stuff if it wasn't for them.
Well, if you had some of that systemic ego that we were talking about earlier, I think it might have left in that first 90 days.
Oh yeah, it's gone. No.
So, I'm going to jump forward to business side of it because I find that interesting. I've got some friends who are dentists. And I got one friend who's another coach, and she's a recovering dentist because she hit burnout, and that's actually what she does is help dentists that are burned out find something else to do in their life, which is kind of neat. I have another friend who does that with lawyers too. It's kind of an interesting thing. But what I find interesting about the whole thing of doctors, particularly outside the military and doing what you're doing, and this will lead us to more of that, but not being part of a big medical system. You're running a business and doing your doctor stuff. So tell us about how you're balancing that now, or how you're managing that now.
We'll probably talk a lot about my dad today. I'll be totally honest with you. I think that being a businesswoman and being an executive, I am not an operator by nature at all, period. I don't have an operations gift. I am a gifted executive. And I think that I got that honest because my dad was as well.
Mm.
Even in high school, we would sit around the dinner table and say, "Hey, Dad, how many people did you fire today? What'd they do? What'd they do to get fired?" And he would come home and tell us stories. He worked at a factory and he was the executive at the factory, whatever they called it.
Mm-hmm.
And he would tell us stories about, how he would solve complex management problems, and we would troubleshoot his business management problems over the dinner table. And so I feel like I always had a slant toward business, and it's easier for me to think about business than it is medicine.
Mm.
It comes more naturally. Medicine is harder. And so I think it's just a natural extension, because as I became involved in medical, even being a battalion surgeon is kind of like a business job, because an Army unit is like a business organization. It's got all the same functions and widgets that a business has. And the battalion surgeon is just like the senior medical advisor that doesn't practice medicine, but advises the commander on medical aspects of the unit. You know that. And so I feel like every role I had in the military, aside from ones that were strictly just practicing medicine, it was all business adjacent. And I like it. It's a lot of fun. And so I think it was just a natural extension, because whenever I have a position, really no matter what it is, I find myself like peeking into the business and like offering unsolicited advice to see if they'll listen. And then if they do, then they start bringing me in on things, and then it just happens,
And we only talked about rugby at the dinner table. So sorry, Camden. No business advice at the dinner table in the McGregor household when he was growing up.
I'm doing all right with rugby, though.
Yeah, that's right. Well, yeah. See, there you go. I mean, she and her dad talked business. Now she's a businesswoman. We talked rugby. Now you're a rugby coach. Well, there we go.
On that though, Laura, what led you more towards the medical and Army rather than just going business? Was it a little bit of resistance to follow footsteps?
That's a great question. I think it goes back to the like schooling thing. So here's how it happened. It was the early 2000s, right? And the war was new. It was publicized everywhere. And, you couldn't turn on yellow ribbons on all the cars and yellow ribbons and USA, everywhere you turn. And it was a real patriotic, place and time to be in. And I was very academic. I was very scholarly. I always had a knack for science. I always did the science fairs. I was on the academic team, and I did the quiz stuff, like ultra level 10 nerd type of stuff we're talking here.
So you just wanted more school.
And at the time when I made that, but I also do have a rebellious streak in me. I'll be totally honest with you. And when I said I'm going to go into healthcare, I had a bunch of people in my world that knew me as a musician that said, yeah, you're not going to do that. You don't want to do that. Why would you want to do that? You're not even going to be good at that. And I was pretty much like, well, I'm going to show you then. We'll see what you think about that, and so the idea of business school never even came up. I think it probably came from the fact that my dad knew me so well. He thought that I should go into something like healthcare. We also talked about law school, but he was like, you would hate it because all you do is sit around and read. I don't know. We never talked about business school, but I did go back and get an MBA. I watched him getting his MBA. He got it when I was in high school. And so maybe he was suffering so much during his MBA that he was like, I'd never recommend that you do this. I don't know.
Something to be said for that. Yeah. So when you got out of the Army, what made you go into this, I guess I'll just call it the more technologically different, as opposed to, your passion, your early on passion of helping people, being a family practitioner. I always think back to, my vision whenever I hear that was my family doctor growing up, and the same building's still there, believe it or not. And Dr. Perkins, I remember his name. I remember going to see him all the time. And why did you not, what made you not just do the brick and mortar thing?
I've never wanted to do that. That is not, that type of career is not within me at all. I could never envision myself working in the same place or doing the same thing or even being with the same people for my whole life. That type of work and career, I never entertained the idea of opening up a practice. It was never on the table. I think I always knew that I would go into executive work, and I always knew that it would be administration. But after being in the military, it was very clear that I would never be institutional again, ever, because what's the difference in working for the government and working for a major hospital system?
Yeah. All right.
They close the door during a urinalysis.
Yep.
You know what I mean? Like, what's the difference? And so I knew that I was not going to work for an institutional healthcare system. It just wasn't going to happen. And the future of healthcare is in digital health. I want to be where the innovators are. I want to be where the people who are driving change and who represent the future of healthcare are, not the past and not the present. And so I think that I sought out people who were like me, who want to have change, who don't want to just get stuck in the status quo, working in the same building with the same people, slowly dying for 30 years. That thought never occurred to me. And I knew there was more and went to go find it.
Explain that a little bit. The future of healthcare is the individual. What define that for us?
Yeah. So let me ask you this question. If you want to go shopping,
No.
you can go shopping anywhere that you want to go. You can go shopping online. You can have food delivered to your house. You can have groceries delivered to your house. You can have food delivered to your house on a schedule. You can have food for your dog delivered to your house. And you control everything about how, when, where, why, how often you shop. Mm-hmm. And the same thing goes for banking and dating. I've even heard you can buy cars online recently. But the one area in which we have given up almost all of our control as individuals is healthcare.
Yeah.
Why is it that somebody else owns all my healthcare data and I have to request them permission to have my healthcare data and give it to someone else who's trying to take care of me? Why is it that we as individuals don't have a choice in how we're taken care of, where we're taken care of? Why don't we have those same choices when it comes to healthcare that we do basic things like shopping and banking and mailing letters? Healthcare is far more important than that. And right now, as the individuals, we are beholden to the systems that we are forced to be within when it comes to healthcare. And what we've seen over the last 10 to 15 years in telehealth is a lot of that, even though it's been, some would argue more expensive, some would argue less expensive. It depends on what kind of insurance you have. If you have great insurance and everything's paid for, telehealth's more expensive. If you have no insurance and you have to pay for everything yourself, telehealth is much cheaper. But what telehealth has allowed us to do is to break free, or at least start to break free, or envision a world where we can be broken free from the constraints of institutionalized medicine with payers and insurance companies and healthcare, and put us back at the center of being in charge of how, when, and where, and why we get healthcare. It's very exciting.
What I'd like to go a little bit more on that as far as removing the constraints. When it comes to telehealth, what comes to mind for me, maybe it's because I worked in a rural town for a while, but is more small towns where you don't have access to the hospitals like that. People can't get there. But one of the other things that is of clear opportunity for growth in that area is the lack of, and I don't know if there's a better term for this, but the lack of times that people go to see a doctor for something that is so small, but if you go see them, it never becomes big. But because the way the healthcare system is set up, so many people just, wait till the last minute to go see a doctor. So you're removing that barrier, you're providing it to rural communities. What are some other constraints that are removed and, being expanded on besides those?
My favorite one is the business day constraint, because traditional medicine happens, and I'm not referring to emergencies or traumas or giving birth. Clearly, there's some things that need to and should be done in a hospital, right? Like having surgery, or you have a heart attack or something emergent needs to be handled at the hospital. But beyond that, if I'm talking about like non-acute, non-emergent, non-life-threatening things that are happening, you have this business day constraint. Healthcare has traditionally taken place between 8 a.m. and 4 or 5 p.m. Or if you're lucky, you might have access to an after hours clinic. Or you can succumb to the mercy of an urgent care and go sit for an undetermined amount of time to receive a questionably, hopefully helpful alternative, and then go to try to get your medication, which adds a couple more hours if you're lucky and it's at the pharmacy the first time, right? So we have this business day constraint. And like, for example, if I go to book an appointment with my PCP, 90 days in advance, maybe 3 months, 2 months, maybe longer. And if it's acute, I got to go to an urgent care. The sad thing about that is that we are stuck in those time constraints. But with virtual health, it removes the notion that healthcare occurs between 8 o'clock in the morning and 4 o'clock in the afternoon. It gives you so much time back, and the freedom, and not only freedom for the patient, but freedom for the doctor too. I've seen patients at 10 o'clock at night, and there's been stages of my life where that is the best time for me to see patients. I'm at home, everybody's in bed, it's nice and quiet. I can give my time to the patient. And it's really freeing from a time constraint standpoint.
Could you touch a little bit more on the preventable care side of that? Because you kind of mentioned, obviously, surgeries and whatnot. I don't know about you, Dad, but I was picturing getting the advice of the doctors. Like, all right, so now run the knife right along there. You're going to see that ligament. That's what we're working at. Like, okay, obviously, not everything can go to telehealth until the robots get better, I guess. But preventable care is a big gap in that, kind of like I mentioned. Could you quantify that a little bit for us before I speculate too much, as far as like preventable care and what that means in the bigger picture?
Yeah, it's getting better. So you're just talking about the lag time for technology to catch up, right? Because the ability for a doctor and a patient to hop on a video or hop on a phone call was a rapidly deployable solution, as opposed to developing like at-home lab testing or mail-in lab testing or direct order radiology screening, genetic tests that do like saliva samples and test you for things, and Cologuard. You've probably seen that, which is colon cancer detection. And so it's catching up actually with lab testing and remote patient monitoring, which is where smart devices are tracking what's happening with a patient remotely and transmitting to a doctor at a different site. I think it's catching up actually, and it's getting much better. And in the coming years, I think we're really going to see the emergence of all the technology devices and more that people have been developing for the last several years come into fruition to an extent where our virtual health capabilities are just, tenfold better than what they are now.
And on the, I guess inside of that, is there any sort of metric that you learn as a doctor for, because I feel like I've heard it. I guess that's why I kind of grasping at straws as far as what percentage of things, if we could identify earlier, prevent those worse outcomes in the long run. Kind of just like we were saying at the beginning of this conversation, of just the ability to see more often and, at more convenient times and all of that. How much does that help? I guess that's why I'm trying to quantify it somehow.
Yeah. So I think what you're asking is if you can get to see your doctor more often, and the doctor can do what they need to do more often, which we're talking about things like annual physicals, right? Just simple checkups that most adults don't. Most healthy adults don't go get checkups. They don't go see the doctor until
I'm averting eye contact.
I was like, I don't know who that is.
I know. I was keeping eye contact, ready to just burst into flames.
Dad, when was your last checkup? But healthy adults don't get checkups a lot, but there are plenty of guidelines out there that tell us that there are certain things like blood pressure, for example, diabetes screenings, cholesterol screenings, that healthy adults should still be getting done in their healthy years. I don't know exactly what the aggregate of each, because the way that it's done in primary care is they come up with those screenings by individual preventive measure. And I don't know that it's ever been aggregated to say, if you do all these things with, properly, then you could prevent this much. But I do believe that virtual health achieves that. It removes all the barriers. Like, I have to leave work. I don't have time. My doctor's not available. I don't like to see doctors. I'm afraid of those doctor people. It puts the power back into the hands of patients to say, I want to make sure that I'm getting everything checked on that I may need to get checked on, just to make sure everything's okay for now, without having to go through formality of like stripping down into a gown and sitting on a table and, being in your underwear for 45 minutes and making small talk with somebody you don't know. And,
How did you get exposed to this? Because, one of the origins I always like to learn about it is in the business side of this. Did somebody say, hey, Laura, we got an idea? Or were you kind of in that, well, what if, kind of maybe some exposure while you were in the Army to the telehealth or what?
Or I was going to say, or some cool piece of technology. We were like, oh my God, that's the future. Like, which one was it?
Yeah. So it was me wanting to send my kids to Montessori school and needing to moonlight and make more money. But it's super hard to, because let me ask you this, put on your officer hat, right? And Captain so-and-so comes to you and says, hey, I'm going to start moonlighting, pulling shifts at someone else's hospital. Can I have permission to do that? Colonel Yu is going to say, why don't you go pull more shifts down in RER and make exactly no more money if you feel like you need to be working more, right?
Yeah, so, pretty much it. How'd you know I'd say that?
Yeah, right. Yeah, well, I mean, that's
read your book.
Right? So, Captain needs more work. Captain can go volunteer for such and such Army hospitals ER if they need more work, right? Yep. So, but I didn't make enough money to put my kids in Montessori school. Just as a captain, doctor with 2 years time in service, because education years don't count. I just needed to make more money. So I signed up to where one of my buddies had met MD Live, which is a telehealth company, at the annual conference, like the annual doctor conference where you go to get your education lectures for that year, because we have so many credits we have to do. And they had a booth set up and they're like, hey, yeah, virtual health, you can sign up. You don't have to go to another hospital to moonlight or whatever. And so I signed up for it because it was not asking to do shifts at another hospital and likely being told no. And thankfully my command at that time was like, sure, we don't really care what you do on your days off, as long as it doesn't interfere. Cause I was a hospitalist. So it was 7 on, 7 off. I was doing 12-hour shifts, 7 to 7 or whatever. So on my days off, I started taking calls for the telehealth company. I think it was probably not even 1 month into doing that. I told my husband, I said, this is a career. Like, this could be a viable source of income that doesn't involve me slugging 12-hour shift, slugging out 12-hour shifts in a hospital after I get out of the military. Like, this is, and we did the math. I said, if I have so many licenses and I do this number of patients a day, then I can replicate my income right now. And we test drove it on maternity leave. When I was on maternity leave with my third son, we said, let's see what it takes to reproduce your income if you can actually do it. I doubled my income during maternity leave, like 2x, like not just replicated, but replicated by 2x my income on maternity leave. And when that happened, I said, this is it. Like, this is it. This is what I'm going to do. This is how it's going to work. I'm never going back to full-time hospital. And I still had 5 years left in the military at that time. But we made it work.
That's really interesting, because the opportunity to do a test run in a business idea like that, and then doesn't happen very often. That's I would put that in the unicorn category of starting a business. Excuse me, but just having that test run, that must have felt pretty good. And when you finally, finished those extra 5 years with the Army, and you stepped out, took the uniform off, what was the fear going out into the rest of the world, non-uniformed?
It's a really interesting feeling to describe, taking off the uniform. And I'll say that I feel very thankful that I had the opportunity to really overlap that transition, because when COVID hit in 2020, that job that I was doing at that time, it was administrative. And so me and the colonel was the only two people that came to work. We stopped. It was WTU. I was doing WTU at that time. So we weren't taking new patients.
That's Warrior Transition Unit for everybody out there. Yeah.
Warrior Transition Unit. Yeah. And so we weren't, which is like it's more of like a medical type of military unit, if I could say what that's like. But the hospital was pretty much shut down. All of our civilians were not coming to work, and we couldn't take more soldiers. We couldn't do VA. VA quit doing exams. So there's nothing. We couldn't run the gym. We couldn't go to the gym. Couldn't do anything. Everything was completely shut down. Virtual meetings. I was pregnant, so nobody wanted to come near me because they were all afraid that they'd give me COVID and I'd die. So I really had, which is, it's funny in hindsight, but
funny now, right?
Yeah, but at the time they were like, oh, I don't want to come near the pregnant lady because it's COVID, and so I really spent a lot of time sitting in my office with literally nothing to do. And I had already put in my UQR. So I had which is unqualified retirement or resignation, unqualified resignation. I quit.
Not close enough. There was quitting paperwork.
No,
right.
I quit. Yeah. And so I actually had the opportunity to overlap the two. But the biggest fear, honestly, was knowing how to act right. Knowing how regular people talk, learning a new language. That was the biggest fear for me. And I had a friend who was a civilian, very good friend. Her name is Alicia. She's incredible. And she was the person that I would like message on the side and be like, okay, I want to say this. Is this something that people understand? And sometimes she would say, no, I have no idea what that means. What are you trying to say? Or like phrases and acronyms that I would use. Like sometimes I would use the phrase like double tap on that, which is a shooting term, but regular people don't always know what that means. Or I've kind of forgotten, but that was, I think, the biggest fear is understanding how to communicate with people, not shedding sir and ma'am, and stopping using very respectfully in my signature block was really hard to do. Those were some really deeply ingrained. And, my CEO, I work with a lot of various CEOs. I do a lot of consultant work, and they're like, stop calling me sir. You're making me uncomfortable. Why are you standing like that? Relax. Like put your hand, like, honestly, it's like, what do I do with my hands? Yeah. Oh, I'm going to put them in my pocket because that's what real people do. Okay. I'm going to carry my purse with my right arm now. I think it's just so much about, okay, I'm outside and I don't have a hat on. It's okay. And I just think it was just a lot of assimilation work of how to talk and how to act and what to wear and how to speak and how to relate to people. It was a institution, like a deinstitutionalization.
Yeah. And with the fellows, the vets, soon to be vets that I coach, that's one of the things we always talk about is, and you're proving that point. It's not like you had to go back to doctor school and relearn, how to be an MD. You just had to learn how to speak differently. And it's really nothing different than that. And that's always one of my foot stompers when I'm working with those guys and gals and helping them understand. You don't have to retrain yourself. You just have to learn how to speak different. That's the big thing. So what's going next? I mean, we've kind of touched in it a little bit in the telehealth world and things like that. And then I want to know where your business is going next, but I want to know what, in a bigger picture, what do you all see since you're living it every day in the telehealth world?
It's crazy. I mean, what I'll tell you is that it kind of feels like being inside of a ship in a Star Wars movie, and they hit the button and all the stars go past them real fast, but the ship still feels like it's not moving. That's what it feels like to be in the telehealth industry, because the speed at which the entire industry is evolving at a ridiculously unbelievable pace, it's hard to get caught up with, and it's easy to become outdated and archaic in the way that I think and what I believe and how I understand the industry to be at any given time. But it's so exciting because the laws are loosening up, which allows for more definitions of practice of medicine. Technology is developing, like virtual hospitals and virtual surgeries and robots. You weren't kidding when you said robots. That's true. Robots are a large part of the future of healthcare, and it's very exciting.
Kind of freaky, but really exciting.
Yeah. I mean, removing the notion of human error is, not that robots don't ever have errors, but they have less than humans do. And, precision and just it's very exciting to me to think about that. But I think the future of healthcare, it's going to be technology driven. We're going to see a lot more remote, a lot more virtual, and we're going to start to shed some of these old beliefs about what healthcare is and how it should or shouldn't be delivered. It's a lot of fun.
I think one of my personal experiences. This is after I was out of the Army, but I was doing some stuff, and it is that remote, being able to call up the doc, the special forces medic who knows a lot, but being able to, being deployed forward and calling up the doc and getting the advice right there live. And that was just that kind of like for me, and that was 5 or 6 years ago. So I know it's leaps and bounds beyond that at this point.
I mean, that was my first telehealth too. Technically, the first unit I was in was a highly deployable unit. When we did AFRICOM, it was like under the SOCAF umbrella and all across Africa. And I was never there because the medics were all over the country or the continent, really. And it was somebody got appendicitis in Uganda, and we all had Apple, so you can get the iMessage and everything. You can call over Wi-Fi. So they called me from Africa and said, "Hey, doc, like we need to talk about this guy." And it was a telehealth visit. I said, "You've got to take him to a hospital. Like he cannot evacuate. It's got to happen right now. I hate it for you. But it's got to happen, And he did. He had his appendix taken out in Uganda, and they all have crazy stories about what that was like, but he's fine. He's fine. He made it out, but we did a telehealth appointment from Africa and got that guy what he needed.
We talked some about burnout earlier in different fields, but doctors, of course, are not immune to burnout. One of the things that I've read as far as a biggest factor for that is the decreasing amount of you could almost call it like doctor time, but like the face-to-face visiting and like all of that kind of stuff. We've talked about it in other lines of work, Dad, of the, you take away the cute kid factor while you're doing the job type of thing. So do you think that telehealth has the opportunity to fix that? Or do you think that's more systemic of, because what I remember the reason being was a lack of basically qualified assistants to do all of the extra stuff so the doctors could still do the face-to-face. Do you see telehealth helping that and solving that problem? Or do you see it exacerbating the lack of assistance already? And then, we still got to solve that problem.
I would be really interested to see where that like data I would say came from, because I truly believe, and this is just kind of based off of, I have a lot of doctors that I talk to and have huge doctor networks of, hundreds of people, and constantly review a lot of feedback from doctors. I feel like and I hate to say this, but I feel like one of the major contributors to physician burnout is actually patients. There is a tremendous amount of distrust right now and skepticism over healthcare, and it is emotionally exhausting. I know my body, I know it's best for me, insistence
kind of the WebMD they were Googling in the waiting room type of thing. So
yes. And I think there's a lot of abuse. There's a lot of physician abuse and nurses too, right? But I'm speaking from the physician perspective because I am one, but there's a lot of physician abuse out there, misuse and abuse. And it's exhausting. Like even for me, I do one hospital shift a month so that I can stay relevant. And 2 shifts ago, I showed up and there were 3 people that were going to sue me because I was not going to give them ivermectin for their COVID, which I don't want to turn it into a political discussion, but I get it. There's some people that buy into that. I'm a traditional allopathic physician and I do not. And so, but people are so aggressive and they're emotionally exhausting to take care of, and I think that contributes a lot to burnout. And I think telemedicine does largely shield doctors from the aggression and the harassment and the anger from their patients by distributing that amongst lots of different people, right? So nurses, support staff, or just stays within the EMR and never shows up in front of people. We have the ability to, for the lack of a better word, fire patients if they come on and they're spewing out curse words or they're being inappropriate and like making inappropriate advances to their doctor, which happens a lot. You being, sexually inappropriate and things like that. We can fire them. We can terminate them. We don't have to worry about them physically coming and harming us or breaking into the clinic and calling security. And those are some of the things I think that contribute to burnout that virtual health really, really helps offset.
And I think just to kind of a like stepping back moment on that is one of those that's showing that how complicated a lot of problems are. Because I had this one little corner of it that I remember from that article, throwing it out, and you just opened up the whole can of worms. So very complicated, of course. But telehealth is helping, which is good. Moving in the right direction at least.
I think so. I honestly do. I think that with the way that people's access to knowledge and information is evolving, we also have to evolve their access to doctors in order to protect the resource. A physician's brain is a resource. And if emotional harassing barrages from patients are eroding away at a physician's ability to do their job, resulting in burnout, it's also making them ineffective in their role. And so things like virtual health and providing barriers between the patient and the doctor is actually a way to conserve that resource of a physician.
Well, speaking of resources, you kind of mentioned earlier talking about the collaboration on data and getting records from different places. Is that something that telehealth is going to plug those or start to plug those holes on? Because I know I've had that person. I'm sure you've had even worse stories at the VA and stuff, Dad. But I know I've had that where I needed to go up to Colorado to get a disc of an MRI so I could drive the disc down to Arizona to give it to a doctor so that they could look at the MRI and tell me what was wrong with my back. Like those sort of inefficiencies when you're coming from the business world, especially, you're like, oh, this is so inefficient. Why are we like that? Is that something that there's being progress made on as well?
I don't know whether there's being progress made or not, but I do envision a world in which the individual becomes the owner of their own healthcare data. I'm of the opinion that health systems and hospitals, imagine if you make it into an analogy like a bank. What if every time I needed to have my credit card information or to write a check, I had to request permission from the bank to write a check or to give out my credit card number. And then I had to wait 5 days for them to give it to me, or I had to physically go pick it up or request that they fax it to a store so that I could make a purchase. It's bizarre. It's bizarre if you think about it in that way. And I feel like we should be able to treat our healthcare data privacy with the same privacy and ownership that we treat our financial information.
Yeah, I'm there's your business idea for the newsletter, Dad. Put that together. Your medical data, and you can connect with the different hospitals and privatize it in that way, so that you're not dealing with the individual hospitals and it's all contracted. Oh yeah, no, there's definitely, because then you get the ownership of it. You're going back to the preventable care side of things that we were talking about. I have the capability to go do those things more easily. There's less barriers to it because I know I've just like you said, 90 days to see your PCP. Like, why am I going then? The cough's going to be gone by then, whether it was a really bad thing or not that bad at all. Like the cough's not going to be there anymore in 90 days.
Right. But why does your data, have you ever looked into the extent of the laws surrounding PHI and privacy practices and patient data and encrypted systems and blah, 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 blah. yeah, okay, but at the end of the day, why is my healthcare data the property of other institutions? Why is it not the property of me? And furthermore, it's a fragmented property of a ton of different institutions. Like, what if I wanted to know things about when I had my tonsils taken out when I was 5?
Mhm.
How do I get that information? I don't know. I guess I find the hospital and maybe they have paper charting that's been archived on a microfiche somewhere. I don't know. I have no idea how that works, but it should be my data.
Mhm.
If I want to go find out what I spent my, credit card on 15 years ago, I bet I could find that information much faster than I could find some doctor's encounter from 15 years ago.
Mhm. I got some regulations I need to read before I write that business plan, I bet.
Yeah, well, I was going to say earlier, Sierra, my daughter, and Cam's big sister, that's been one of her biggest complaints as a PT is that people can't come directly to her. They have to go through this convoluted system, as opposed to just, hey, I twisted my ankle. Why do I have to do all these other things? Why can't I just go to the PT and get checked out? So
why can't you?
right.
Mhm.
Right.
Well, so where's MD integrations going next? What's next on y'all's vision?
Yeah, I mean, that's a great question. The point is to help other companies succeed and also give doctors one centralized location to do their job, if that makes sense. So I think right now it's really in the growth phase, right? Making sure that the tech is sound, making sure that the doctors are happy. We have a really physician-centric approach. Instead of making the doctor the victim of the system, we make the doctor a key stakeholder and allow them to share in the decision-making of how to make things better. So I think which is important, right? The internal stakeholders should be treated with just as much care as the external stakeholders. And I've seen that problem a lot with direct-to-consumer businesses. They forget that the internal stakeholder is also a consumer, even though they're not necessarily paying. They're earning money for the company with their hard work, and their level of engagement reflects how much of an asset they are to the company. So I think that's the next step, is to continue working on the physician experience and the UI from that from that side of things, just to make sure that it's a great experience for all the users.
I love that you're focusing on the physician side of it also, because I'm blanking on the name of the company, but that's probably a good thing because it wasn't a good read. But they were being sued by some of their physicians. It was a telehealth in the mental health area, and they were being asked to prescribe things after like 15-minute phone calls. And so all of the doctors are suing the company now because they were forcing them to prescribe stuff after 15 minutes of interaction.
Yeah, and to be fair, I will say that will not be a successful lawsuit. Because of corporate practice of medicine laws and the way these types of things are set up. You can't force a doctor to write a prescription. They're not going to win that lawsuit. And to an extent, I feel like that is bad press, to be totally honest with you, because I'm aware of that company and what's going on there. But every single one of them, I hate to use this term, sign the dotted line.
Yep.
And they didn't have to, but you know what? A 15-minute synchronous telehealth visit is rapidly becoming the standard of care in order to provide things like Adderall. We don't really need to talk about it for more than that. I mean, how much do you need to talk to a person to know that they have ADHD in order to issue a standard of care prescription? I think they got their feelings hurt. That's a whole nother can of worms, but it sounds like a bunch of people who got their feelings hurt, probably because there was a shift towards utilization of nurse practitioners or salaried physicians, and they were not making as much money as they were before. Let's talk about entitlement issues. But sounds like a bunch of people who found the right lawyer and got their feelings hurt. But who knows? We'll see what happens.
I love it.
Yeah. So what did I learn? Jeez. I tend to go back to the fundamental things that get repeated, and so it's kind of not really what I learned, but what I got reminded of. And you realizing you could not be successful if you were the smartest person in the room, or if you thought you were the smartest person in the room, looking around and saying, hey, I don't know how to do this, Sergeant Smith, Sergeant Jones, can you help me? And being open enough, humble enough as the person in charge to say, we got to do this. I don't know how to do it. Does anybody else know how to do it? And then listening to those people that know how to do it. And so I always love hearing that lesson. And especially when it talking about our NCO Corps, fond memories, because I had the privilege of those working with a lot of those guys in my time and sitting down and being schooled by them quite a bit throughout my career. But that's it. I'm also laughing at you. You probably didn't even know how to do land nav and got told to do a land nav course. So
I ordered pizza, had it delivered. That was the best I could do.
There you go.
The NCOs did the rest.
That's it. That is a great secret to success. Just order the pizza and listen to the experts. There you go. Camden, what'd you learn?
I learned that I definitely need some more friends and acquaintances in the medical field, because the amount of things that are coming to mind of random things I've read that I just like to bounce off. Like, I got all my lawyer friends. I've got friends in different stuff that I like to, take to lunch and ask different questions. I need some more medical field friends so I can ask more random questions, because I'm a curious person. It's a fascinating field. When you come through it from the business side, start thinking about it. There's so many little things that are just so fascinating about it. So Laura, we'll have to get another call then.
Anytime.
Laura, how about you? What'd you learn?
One thing that really struck me is, as I'm sharing about what I, learned from my dad, and then hearing about how what you were able to impart on your son. I have 4 kids, and it's a reminder to me. But I would say maybe I did, learn, but how the things that I say and the things that I do and the lessons that I express out loud are absorbed and spoken into the lives of my children. There's 4 of them, and the oldest one's 8. And so I'm reminded to still be very intentional about the things we're doing, the things we're talking about when we're together, and making sure that it's substantial and meaningful, and speaking things that will bear good fruit into their lives, and not getting distracted by some of that. We can talk about silly things, nonsensical, unmeaningful things, which is fun too, but the substance is also very important.
I can't let this question go. When are you going to start singing again?
So I don't know. So my thing was piano, actually. So I was a professional accompanist. Wow. And I do sing as well, but I'm a better pianist than I am a singer. I would love to do it. I'm in Nashville, Tennessee.
No.
I know. Occasionally people will ask me to do something, but I think I need my kids to be old enough that I can practice without them like banging on the keys. So soon, it's coming back, I'm sure, soon.
All right. Because I know the piano would be kind of tough to set up on a street corner down there on Broadway, but just saying. It's
coming back. I feel it soon.
All right. Well, Laura, how do folks get in touch with you, learn more about MD integrations and what y'all got going on? Absolutely.
You can find me on LinkedIn, Laura Purdy. That's probably the simplest way to find me. I love, chatting with people. And I always tell people, I don't ever charge people for a conversation, right? I love to meet people. I love to chat. There's no fee to talk to me. I don't have, consulting fees or anything like that. But especially like business owners, innovators, people that want to get their idea off the ground but haven't made the leap yet. I want to talk to you, because we got to make this stuff real in order for the industry to move forward. So I'd love to chat with y'all.
Thank you very much, man. This has been a lot of fun. Some great insights to some technology in the healthcare and identification of some problems that we probably, like Camden said, business ideas out there, folks. So hope you're taking notes. Laura, thank you again for your time with us. And Camden, run us out, please.
All right. Thank you all for listening to today's show. Special thanks to our guest, Dr. Purdy, for joining us today, and our sponsor, Tribe and Purpose. Find your tribe, find your purpose. You can check out recent episodes of the Cam Otis Show on Spotify, Apple Podcasts, wherever you get your podcasts, and check out a full archive at thecamootisshow.buzzsprout.com. The Cam Otis Show is on Facebook, Instagram, and Twitter. Thanks again, and we'll see y'all next week.